Well, welcome back, everyone. And I do hope that you received the filled out ACCU baseline assessment. So you should now have, if you haven't already downloaded it yourself or printed off yourself, you should have been sent a clean version and the version that has all of Eric's details. So I'm not sure, and I apologise because I really didn't read the list on Monday. So I apologise if you have already heard this or seen these first couple of slides. That's me, that's who I am, that's my name, and that's how I can be contacted. I do want to highlight the fact that this used to be our old website, which has now been superseded by this new, wonderful, super duper, gorgeous looking one. And just for your information, the search engine is now that little magnifier that you see at the end of those words: get help, cannabis and you, parents, professionals, news, Indigenous, and then that little magnifier there. That's the search engine that we now have. Now, we've got lots of glitches, and I did a workshop this morning, and I was informed that those glitches are still occurring because someone logged on and was very surprised that she couldn't get what she wanted. But please be patient, stay with us. All those glitches should be over within the next 2 weeks, I suppose. But maybe by the time you come back from holidays next year, it'll be fantastic. So that's what it'll look like. And as you know, we have so many resources available to you that you can order. But again, wait until that little tile is up. And the ones that you will need is the ACCU, and I'll show you photos of that in a sec. Something that you may want to download and have a look at, which is based on the evidence and based on the research as we know it, are these clinical guidelines that we put together when we first started about 6 years ago. So have a look at those. They're not how do I deliver interventions, but more what does the evidence say about what I should do or what is the best tool to use, such as screening, assessment, family interventions, withdrawal, and so on. So please have a look at that when it comes back online, and I think the URL actually has changed, so stay posted. Now, for the ACCU, again, I need to stress that it is based on MI. Both the assessment and the feedback session is based on MI. So for someone to do the ACCU, they really have to have a handle and feel a bit comfortable about using MI. And my suggestion is that you get a hold of this latest book and read it, and just, attempt, I don't mean read it cover to cover, but I mean dip into it and out of it, attempt what's inside and see what works for you, what feels comfortable, and keep practicing it. And so, again, within a very short period of time, you should be comfortable using MI. And again, depending on where you are in your career and how much you want to invest in it, I think this is a really good idea. Just to really give you the key points of MI, it is about expressing empathy, it is developing discrepancy, it is supporting self-efficacy, so you must look for self-efficacy. You must look for something positive in that person's history, no matter what it is. And then obviously part of doing MI is using open-ended questions, reflecting, and affirmations. And I'm sure you're all familiar with what happens when you talk about trying or even just talking about changing behaviour. The thing that most clinicians are met, or even parents of children, that are trying to get someone to change a certain behaviour, the thing that we're met with is resistance. So that is what we deal with on a day-to-day basis in our jobs, is to deal with that resistance, because that's part of suggesting change for a person. And the best way to deal with resistance is through reflection and affirmation. So I just thought I would kind of, draw your attention to that particular point. Okay. What I'm hoping to achieve is to provide you with an efficacious treatment for people who are smoking cannabis and to familiarise you with the resources that we have when you're talking to people or trying to use the ACCU. And I did on Monday go through the pilot that we used and the randomised controlled trial. And if you'd like, you can listen to that webinar again and get a hold of the journal articles on which this ACCU is based. So by the end of the webinars, both this week and next week, I hope that you will feel more comfortable with the intervention in an attempt to use it and the resources. So the more familiar you are with it, the more comfortable you are with it, the greater the chance there is that you will use it and be happy having something that you can use. So why would we suggest that you use this ACCU, brief intervention? Well, it's standardized. That is, there is nothing for you to organize or get. It's all there on a piece of paper in some logical order and sequence. We know that it works. We have validated it through research that we've done. The material is available for you, and we know that it will increase chances of affecting change in a person. So today I'm going to go through the ACCU with you, and I'm also going to insert, or Redback will insert, 4 little vignettes or videos that will demonstrate particular points. I will talk you through the whole lot, but I will also show you some of the, not the most important, but some of the things that I think should be highlighted or addressed. So the ACCU needs to be a collaborative conversation. And it does need to feel like a conversation where a person is heard. You are exploring the relationship between what they're seeing you about, and it could be that they're seeing you about cannabis, but very often, because it's very hard for me to know who I'm talking to, very often it may not be about cannabis, it may be about something else. And so throughout that, or through that discussion, there needs to be an exploration of what they're seeing you about and cannabis use. And you need to kind of, you know, I guess play devil's advocate a bit and, look, I'm not sure whether cannabis is playing a part in whatever, so let's explore that so we can either look at it more closely or we can rule it out. And in so doing, you hopefully are drawing out their own reasons for change, and if you are drawing those out, you're going to start to hear some change talk. That's come out of the MI literature. It's called change talk, and if you hear change talk, then you can support them with a change plan. And so that is really the essence. Again, I absolutely want to stress that the ACCU, even though it looks like that, is not a tick and a flick. It is not a counselling session. There is no suggestion of change, and there is no suggestion that they have a problem. So I really need to stress that. It's an invitation to have a conversation collaboratively about cannabis. Now, some of the ACCU assessment they fill out, and some you fill out. So just check for literacy issues, and you will tell them that before the session starts. You'll actually tell them that when you first see them during your normal assessment period, where you see a person for the first time and invite them back to look more closely at cannabis in the following week or day. So you do your regular assessment or intake, you identify that cannabis is being used, and according to your good judgment, is being used excessively. And so you will just very casually say, look, I'm not sure whether cannabis has anything to do with this, but, you know, we've got a checkup, what we call a checkup. It's just some questions looking at cannabis use more closely. Are you okay with coming back and doing that with me so I can either rule it out or maybe talk about how it's impacting on whatever that particular thing they're seeing you about? That's really the way in which it's introduced and invited. It needs to feel like that and not a counselling session. So the ACCU checkup consists of 2 sessions. One is the assessment session, which lasts anywhere between 45 and 60 minutes, depending on, you know, how much talking they want to do. Now, if you're dealing with 15-year-olds, it's going to be very quick because they're monosyllabic usually and don't want to, you know, elaborate on a lot of things. But it could even take 90 minutes. Again, it just depends on how much time you have. And then, of course, there's the feedback session, which, again, is anywhere between 45 and 60 minutes. And if at the end of the feedback session there is some recognition that perhaps they'd like to have a go at reducing, then there's an optional strategy session, which is based on CBT. So today we're going to be doing and going through the assessment. So as I said, I hope you've all got a copy of Eric's filled out one, which is going to be what we're going to be pretending to do. All right, I'm not sure whether you were here on Monday, but remember Eric. This is Eric, everybody, Eric M. Eric is a 23-year-old male. He's a carpenter who still lives at home with his parents. Excuse me a second, I need to cough. It took him 5 years to finish his certificate to become a fully fledged carpenter. He's been employed these past 2 years. He has a girlfriend and has had a girlfriend for the last 18 months. He smokes around 8 cones a day, 2 in the morning, 2 after work, and the rest over the course of the evening. He smokes or tends to smoke more on a weekend. He's always having drama about his smoking, either with his parents, because he lives with them and they don't like it, or his girlfriend. Now, he presented, let's just theoretically say, he presented to me as a clinician because that used to be what I did. I was working in the drug and alcohol field, as Dion said. So let's just say he presented to me as part of a diversion program because he was picked up accidentally, roadside testing, DUI, very unlucky. He doesn't normally drink and drive, but he did that night. The policeman decided to take him down, given his age and his attitude. Blood test, and he tested positive for cannabis. And so they went through the motions and decided to send him to someone to talk to about his cannabis use. Now, he didn't think he'd get picked up because he drives more slowly when he's been smoking, but he just got caught, and that's how it goes. Now, the content of the ACCU is as it states there, and I'm going to be going through each and every one of those headings so that you are feeling comfortable with what they actually mean or represent. So there they all are, and I'll be doing them in a bit more detail. So the first question is presenting concerns. And so the question is, okay, Eric, so what's the main reason that you've come back to see me today? And he basically answers, well, I had to, didn't have a choice, got picked up, they made me come here. And I might say, well, is there any other reason that, you know, you're quite happy to do this? Or maybe not happy, but said yes. He said, well, could say, well, I'm a bit curious about what you'd have to say about my cannabis use or any cannabis use. Fine, no problem. No other reasons? No other reasons. Okay, Eric, look, I've got a list of statements here that represent how people feel. Now, could you just read those statements for me and tell me how you feel right now about your cannabis use? So if you could just read that list and tick the one that best represents how you feel about your cannabis use right now. Now, hopefully, he will tick. I'm thinking about it, but I'm certainly not going to do it like, you know, within the next couple of weeks. So that's a good thing. You know, at least he's saying there's no way, don't want to talk about it, don't want to be here, in which case the ACCU is perhaps not necessarily appropriate. Perhaps a briefer intervention might be appropriate. But really this is for people who you've invited to come back and who are willing to talk to you. You've said, look, this is going to take a couple of sessions, particularly next week. It's going to take about an hour. So are you okay with that? The answer is yes. It's unlikely that they don't want to talk about it. Okay, so then you start by discussing the good things about cannabis use and the not so good things about cannabis use. Now, this is a useful way to start because it allows, the exploration of cannabis use in a very non-threatening kind of manner and builds up rapport and minimises resistance because you're talking about the good things first, at least. And then you'd explore, summarise, and you'd feedback. Now, according to Eric, he finds it relaxing, it helps him sleep, it's fun, he enjoys it, feels good, and so on. And the not so good things, well, it creates a lot of drama for him in his life. He has arguments with his girlfriend and with his parents, makes him feel a bit hungover sometimes, when he's had a really heavy session. It feels a bit like crap the following day. And then the next section is about patterns and patterns of use. And really what you're trying to assess is who do they smoke with, what do they smoke, where do they smoke, when do they smoke, and you're really trying to get an idea of their pattern of use. And as you can see, that section there is prefaced with, look, I'm just going to ask you a few questions about your pattern since you started using cannabis. So, now, it says 2 months, but really I think it's good to be consistent. And within this ACCU, and I've now got to get back to it, it's got 3 months, it's got 30 days, it's got 2 months. So there is no real reason why you can't ask everything over the last 30 days. So you can change that if you would like. Again, it's really important to stress that everything he says is confidential if where you work is confidential. And, for him to give you the most accurate answers, if at all. So, try and, as I said, make this a comfortable conversation. All right. Now, you ask who, what, when, where. Does your partner smoke cannabis? Yes. How does she feel about it? She doesn't like it. How old were you when you first started? He was 15. How old were you when you became a daily user? You need to explain perhaps what a daily user means or a regular user. And that's, someone who smokes at least, 4 days a week, 4 out of 7 over the last, again, 30 days. Your typical pattern, how much do you smoke approximately? And now you can either do the calculations, if you can, while you're sitting there, or you can leave it in terms of how much they smoke daily and how much that translates into weekly. And then we ask a person to do the timeline follow back. That's what the TLFB stands for, timeline follow back. And again, it's got 60 days there, but by all means, just use one of the diaries there, last 30 days. Now, because people don't smoke exactly the same amount every day, there is a difference between their use on certain days or due to certain occasions. So I think it's really important to go, okay, so that I get a really, really good pattern and picture, Eric, do you remember how much you smoked yesterday? Gives you the answer. What about the day before that? Okay, what about on the weekend? Now you can, if they're kind of struggling, yeah, and it's a bit hard for us to remember what we did, last week or what we even ate. But, if you get prompted, you might be able to remember. But good prompts to the things that I might suggest is, do you normally smoke more on a weekend than during the week? And most often the answer is yes. So what did you do last weekend? Who were you with? And you have a conversation. Oh, I see. And where were you? What did you guys get up to? And how was that? And was that fun? And oh, you really, well, that's really interesting. And so what do you reckon you smoked with your mates at the party or whatever it was? And so they'll give you, an estimate of what it was. And it's usually, as I said, not exactly the same amount every day. The other prompt is when they get paid. A lot of people, when they get paid, that is a trigger to go and buy some dope and to smoke and smoke more, and it's there and it's fresh and so on. Perhaps an argument with a girlfriend or a parent may have prompted them to use more than they would have otherwise. So they are a couple of suggestions as to how to kind of backtrack over 30 days as to what they might have smoked, because you'll always get a figure that's slightly higher than what you would if you were to multiply 8 times 30 days. So again, it is all about feeding back. And so the greater the quantity, the bigger the shock. Let's put it that way, just to simplify things. So this is Eric's timeline follow back. And as you can see, he smokes 12 every second Thursday because that's when he gets paid. And, you know, he went to a couple of parties and he had a couple of big weekends and so on. And so you would get that figure, and you would ask then, after you've done that, you might total it up. You'd either do it there if you can or later after he's left. And then there are other questions, such as, are there any situations that you find yourself in or feelings that you get that you particularly associate with cannabis? Because what you're looking for is triggers, right? In the event that it plants a seed about thinking twice about those triggers. And or you could either ask the question, or you might want to use the high-risk confidence questionnaire that we have available. You can download that. You might want to give him that as a prompt, perhaps. Or you could just ask him an open-ended question. And according to Eric, usually when he has an argument with his family or girlfriend, that really makes him feel like a smoke, or before he goes out because he wants to go out and have a good time, and when he gets paid every Thursday. How do you smoke? He smokes either a bong or a joint. And you need to know that, because I think it's important when you inform people that they should try and avoid smoking bongs, as they are less healthy than joints. But anyway, I will leave that for another time. So it's good to know, do you smoke a joint or a bong, or is there any other way? Where do you normally get it from is another question, because you want to know how much of it do they grow themselves. Again, look, Eric, I don't want to know who your dealer is. I really just want to know, you know, where you get it from. Do you grow your own? Do you kind of get it with mates? You know, what happens? I just want to get an idea. So that's the kind of, I guess, prefacing of that question that you might want to make. All right, and then what you want to know is how much money. Now tell me, on average, Eric, how much money would you spend on cannabis per week? Now, money motivates everybody. And what you want to know is how much he spends. Now, according to Eric, he spends approximately $150 a week on cannabis. So I think it's important for you to jot that down, and then after he's left, again, do quick calculations on how much that expands into. So on average, how much money would you spend on cannabis per week, do you think? Now, just back on that, and maybe some people that you know, that you see, don't spend a lot of money. Maybe they grow their own, or maybe they get it from their friends, or get it from their parents. But at the end of the day, it costs somebody something. Nothing, you get nothing for nothing in this life. It costs somebody something, whether it's time, whether it's sexual favors, or whether it's giving people things. It costs, well, even if it's growing, that's time consumed with looking after it or whatever. So usually, not always, costs people something. And more often than not, it costs money, hard cash. Dealers aren't in there for no good reason. All right. Now the next questions are about attempts of quitting and moderating. And if you were here on Monday, when we did the pilot, what surprised us is, if you remember the stats, 58% of those kids that we spoke to had tried previously to stop or cut down. That suggests that there is an awareness that they should do it, whether or not it's because it's costing them money, whether or not they realize that it relates to their cough, whatever. There is some insight about cannabis and cannabis use. So I think it's important for you to acquire this information. So have you ever chosen to stop smoking cannabis? Um, and so you need to find out how many times have you done that, what was the longest period of time that you reduced, how did you go about doing this, and why did you start again? These are really very valuable pieces of information that you can have quite a lengthy discussion about. And it also informs you about where their headspace is. Can they do it again? Where are the weaknesses? And so on. And then the next question is about other drugs. And as I said on Monday, yeah, a lot of people use a lot of substances, but in order to do the ACCU, cannabis needs to be the primary drug of choice. You know, if alcohol is the primary drug of choice and the one that's most problematic, then that's really where you need to work. But this is really for people who are smoking dope on a regular basis, as opposed to other drugs that they're using occasionally. So you just want to, if you've already got that information, that's fine. You just say, look, I'm just checking what you told me last week. I just need to know. But what you really want to know is whether or not they are smoking cigarettes on top of mulling up with tobacco, um, because that really factors in to their lungs, their respiratory issues, um, heart condition, blood pressure, and so on. So I think it's important that you know this information for the time when you feedback about cigarettes and tobacco and smoking and so on. So just checking to see what other drugs they use and how much tobacco they use. Um, Now, the next question is about risks and risk perception. So you need to preface this by asking them, do they understand what is meant by the term risk? So, Eric, do you know what I mean when I use the term risk? I'm not talking about drugs or alcohol. I'm just talking about the word risk, just generally. Can you give me an example of what I mean? Now, hopefully they will generate an example like driving very fast or not wearing a seatbelt or, I don't know, doing what that man's doing, which is taking a big risk that that rope's going to break and he's going to die. So, yeah, that's, you check and you say, yep, that's exactly what risk is. Risk means that you engage in certain behavior that may not necessarily have a bad outcome, but there is a risk that it may. Um, so, yeah, driving fast, there is a risk that you're going to be picked up, just like the one where you were driving slowly, but there you go. You risk being picked up, a DUI and smoking dope. Now, here is a list, Eric, of things that people think are at risk. So can you tell me 4 risks that might, again, might be involved in making a decision as to whether or not you would continue to use cannabis? Just tick 4 risks that you think may relate to your cannabis use in the future. And he, hopefully, you give that to him, you hand it to him, and he fills it out. As I said, there are parts that you fill out and there are parts that he fills out. And this is a part that he fills out, and he ticks the things that he thinks are at risk. He can tick more than 4 if he wants to, but just ask him to tick that for you. And then you need to administer the SDS. So get it back from him. Thanks, Eric. Now, the next thing I want to look at is what we call the SDS. Now, it is extremely important that you preface the SDS by saying, look, do you know how we, by asking a question, do you know how we measure severity of dependence or dependence in the drug and alcohol field? Well, we normally measure dependence through tolerance and withdrawal. Do you know what I mean when I use the word tolerance? What you are hoping to hear is, well, I guess that means you get used to it. And if you don't hear that, then you ask them, okay, I'll give you an example. For example, tell me, how much did you smoke when you first started smoking at the age of 15? How much did it take for you to feel high, to feel mellow, to feel chilled, to really feel the effects of cannabis? And I'm sure the answer will be one cone or a couple of puffs or whatever. And then the question after that is, okay, well, now you've been smoking for 8 years. Tell me, how much does it take now? And then the answer will be given. So it's very, very important, and you will see a demonstration of this, to preface it by saying, do you know what I mean when I use the word dependence? It's measured through tolerance and withdrawal, and you will then invite that person to do the SDS. So if I could get clip number 1, where you are planting a seed about dependence by educating them about tolerance and withdrawal. So if I could get clip number 1, excellent. I thought red.
The next section is looking at dependence. Do you know what I mean by dependence, Eric?
Well, it's like your body getting used to it.
Yeah, that's a good description. So the way we think about dependence in the drug and alcohol field is by looking at tolerance and withdrawal.
Okay.
Do you know what I mean by the term tolerance?
Oh, well, it's like your body needs more the more you use it, because you get used to it.
Yeah, that's right. Can you give me an example of tolerance in relation to your cannabis use?
Oh, well, when I started smoking, I needed 1 to feel stoned, but now I need about 3 to 4 to get the same sort of feeling.
Okay, that's right. So when you first started smoking, 1 cone gave you a good high and you felt really great, and now you're needing almost 4 times that in each session to get the same feeling. So how do you think that happened?
Oh, well, I guess my body got used to it, so now I need to smoke more to get that same feeling I had when I started.
That's exactly right. So what you're saying is you need more and more to get the same feeling, and the other way we measure dependence is through withdrawal. Can I explain a little bit about withdrawal?
Yeah, sure.
Okay. So the way we look at withdrawal is, if you think about over the last 8 years since you've been using, has there been a time where you've really wanted cannabis, been unable to get it, and started to feel physically uncomfortable?
Well, sort of. A few times. I haven't really been longer than a week without it in the past couple of years, but I feel, you know, I get cold sweats and headaches and just feel really irritable, like I couldn't sit still, and just feel really wound up.
Yeah, right. Well, what you're describing are some of the really common symptoms of withdrawal that we look for when we're talking about dependence. I really just wanted to get an idea of whether you'd experienced dependence, and if so, what level of dependence that you may or may not have experienced.
Okay.
Yeah, so what I've got here is it's a simple scale with 5 questions. It's called the Severity of Dependence Scale. So would it be okay if I asked you some questions to get a better idea of where your current usage sits?
Yeah, sure, why not?
Okay. Are you okay with reading the questions, or would you like me to read them out for you?
Fantastic. Thank you for that. Okay, so that's the SDS, and that's what it looks like. Now, you can, I'm a bit scared that you can't hear me, but I'm sure that you'll tell me you can't hear me if you can't hear me. This is what it looks like when you download it from our website, but as you can see, it's embedded in the SDS. Alrighty, so after you've done that, thank you, Eric. You do not score it. You do not reflect the score, unless they ask for it, obviously. But thanks for that, Eric. Really appreciate you doing that. Now, according to Eric, I think his score was 8, just for the purposes of this case and case discussion. After that, then you look at the costs and benefits questionnaire, okay? Now, you give this to Eric to fill out. Okay, Eric, the next part is a list of costs and benefits that relate to cannabis use. So can you read some of these statements and tick what best represents whether you agree or disagree with these statements? So if you were to stop or cut back on your cannabis use, can you please put across to what represents whether or not, how closely it represents whether or not you agree or disagree. So Eric gets this questionnaire and fills it out for himself. Now, believe it or not, these are extremely powerful prompts. He's filling it out, he's reading it, he's thinking about it, he's putting a cross or a tick, and so he's the one that's actually going through the mental processes. It's a lot, it's better, I guess it has more impact when a person does it for themselves than if they're read out, but if they can't read, then seriously, it's not the end of the world and it's not an issue. So you're weighing up the costs and benefits of just generally, and then you're looking at the costs and benefits of reducing your cannabis use, which is the next question, and you're looking at what would happen if you were to increase. Now, you've already planted the idea that it is a drug of, tolerance is involved, and therefore, if he's increased from, a couple of puffs or a cone to 8 in the space of 8 years, or in the last 5 years particularly, then what's he likely to be using in the next 3 years? Now, he's thinking that without you even having suggested it. So again, these are the questions that you might ask him to think about and contemplate. So what would happen if you were to increase your cannabis use? So I also have a clip here for you that demonstrates what happens when you ask that question.
So far we've looked at some of the good things and also some of the not so good things about smoking cannabis. And now what I'd like you to try and imagine is that we're in the future. So I want you to imagine that it's 3 years from now and you're 26. So given what we've just spoken about in terms of tolerance and withdrawal, is your cannabis use likely to have increased, stayed the same, or decreased over the last 3 years from 23 to 26?
Well, we're going up, because that's the trend, isn't it? I mean, there's tolerance and dependence like you talked about. So I was smoking 1 cone and I've gone up to 6 or 7. So I guess I would go from 6 to 8 or 9 maybe.
Yeah, okay. So given that it's likely to have increased, let's have a think about one of the costs that you've already stated in relation to that increase in cannabis use. So I'd like you to think about the relationship with your girlfriend and your parents. What effect do you think an increase in smoking cannabis would have on those relationships?
Well, my girlfriend's already pissed off at me.
Okay.
My parents are always on my backs. If I kept chasing that high, I'm going to cause myself more problems.
So you're going to make things worse for you. If you smoke more, there's going to be more arguments, more conflict. You're going to have more problems.
Yeah, well, when I smoke, we get into arguments, so. Yeah.
There'd be more arguments, more drama, more conflict, and you really don't want that.
Yeah.
So now let's look at the flip side. What are some of the benefits that you would achieve by increasing your cannabis use?
Well, give me something to do, because smoking's a hobby. So if I increase the amount of smoke, that means I'd spend more time doing my mull, and then I'd be bored less. Yeah.
Okay, so a benefit of increasing your cannabis use would mean that you would have something to beat the boredom, to fill in time.
Yeah.
Okay.
I guess the flip side is, though, that I'd be spending less time with other people and maybe doing other things, because I'd be more zoned out by myself. So, I don't know.
Okay.
Maybe there is no other benefits or good things.
So on the one hand, a benefit would be that increasing your cannabis use would fill in the time, beat the boredom, and on the other hand, increasing your cannabis use would mean you would have less time to spend with your girlfriend, your mates, doing things that you really enjoy.
Right. So that's kind of a little demo as to how you would, preface that question and likely answer, because really people are really hard-pressed to find a good reason or something good about their increasing. It just doesn't make sense. They've just been telling you all about the negatives. And so they're really hard-pressed to find anything good about increasing their cannabis use. And again, this is about planting seeds, increasing awareness in order for people to make informed judgments about what they're doing. Right, so once you've done that, thank you very much, Eric. That's great. Let's move on now. The next thing I have is what we call a problems questionnaire. If you could just fill this out now, you may not necessarily, these are, lists that relate to the difficulties that other people who use cannabis sometimes complain of. So just read the questions carefully and see whether or not you kind of agree with that. Just put a yes or a no in the box. And so, some questions specifically ask about problems associated with cannabis use, while others ask about just general problems, that you may or may not experience. So could you please fill that out for me? And as you can see, it's been filled out, and you take it back. Now, you might want to cross out anything that's not relevant, like if he's not at school, or if he doesn't have a girlfriend or boyfriend, or doesn't have a full-time job or whatever. But by and large, he may not live at home and may not have a girlfriend and may not be at school and may not have a job. So all those questions get crossed out. But whatever is appropriate for that person, you get them to fill out. Then we look at demographics. And the demographics. School. When did you leave school? Why did you leave school? Are you employed? Again, in a conversational way. The suggestion is not, what is your current employment situation? Full-time, part-time, employed, unemployed? It's not like that. Are you working at the moment? So what is that your main source of income? Or do you have another way of making money, and so on? Now, you told me you had a girlfriend earlier. Is that right? Yeah. Good. Okay. So what you're asking are general demographic questions. So the next clip is about environmental factors. You want to know how cannabis fits in with this person's environment, if it's causing any issues. Now, we have just used the first three. We've used financial, we've used conflicts with girlfriend, and conflict with parents. But there are some more on that page that you will continue to ask about, obviously. But for time's sake, we've really just given examples of the first three. And again, it is a conversational style while collecting information that you're having with this person that you will use in the feedback session. So please cue in clip number 3. And if you are familiar with MI, you will hear clarifying, you will hear reflecting, and so on. So, yes, let's have a look at that.
So, Eric, I just want to repeat that I'm not here to tell you to change your cannabis use or to cut down or to quit or to get you to do anything at all. I'm just here to explore with you the relationship between your cannabis use and any issues that it may be causing in your life, so that if you do want to make any changes, you can make a really informed decision.
Mm-hmm.
So I'd really like to hear more about your financial position at the moment, especially the way cannabis might be impacting your finances. So how often over the last month would you say that you've had money problems?
Oh, well, it sometimes happens, but I've always got enough for weed. But it is a problem that I can't save anything, because I work full-time, but I'm still living week to week.
Right. Okay.
Yeah. Well, so yeah, money is a problem. I'd say it's an issue. I'm always worrying about money.
So how often each week would you worry about money? I mean, would you say it's sometimes, often, or always?
Always.
Okay. So I know you spoke earlier and you were talking about having conflict with your girlfriend in your relationship. How often would you say that this happens?
Oh, well, almost every day. Maybe 3 to 4 times per week.
So I'm really talking about very serious arguments here. So yelling, screaming, escalating into a very, very serious situation. How often would you have those sorts of arguments?
Yeah, at least once per week.
Okay. So the cannabis really has had an impact on both your relationships and your finances.
Yeah, she puts up with a lot.
Okay, can you tell me more about that?
Well, I guess cannabis comes between us. We'd probably be better off without it. We're always arguing about it or because of it.
Yeah, all right. So what about your parents? What are are there any similarities in the relationship that you have with your parents at the moment?
I fight with them over my use too.
Okay. So a few people in your life are concerned with your use, including your mum and dad, and you're getting into fights and conflict with them.
Yeah. Maybe like once a week or once a month. But I see him a lot less than I see my girlfriend, so... Look, I get that it's causing problems in my relationships, but it's just such a big part of my life right now, so I don't really see myself living without it.
Okay, you just wouldn't be you without it. It's a part of who you are?
Well, it's not all of me, but, you know, it's I'm so many other things.
Okay, so you enjoy cannabis, but there are lots of other things that define you. But at this stage, it just seems too hard to start thinking about how you could live without it.
Yeah.
Okay, well, look, I really appreciate your honesty with me. Sounds like you're really aware of the problems that using cannabis is causing you and creating in your life.
Right. Okay. No, I turned it off. Okie dokie. Back to that. So for those of you who are familiar with MI, I hope that you were able to pick up some reflections such as, so the cannabis has an impact on your relationship as well as on your money. And then there was a question, or no, yeah, well, it was a question. You know, can you expand on what you mean by that? And then there were 2 other reflections, such as, so a few people in your life are concerned, including your mum and dad, and you are often, you know, getting into fights with them, and so on. And the amplified reflection really was, you enjoy your cannabis, but there are lots of other things that define you, and it is hard to start to imagine living without it. And so as I said, if you're familiar with MI, then you will hear some reflections and so on. And then after you've asked those questions, you continue on. What about work? Has there been any conflict at work? And my favorite, how much time do you spend with an illicit using friends? Now, some of you may be too young, but this is a funny movie that is Cheech and Chong, who were, I guess, the heroes, the unsung heroes of cannabis use in the 60s. I just thought that was funny, and I love using it. But let us move on. Okay, then there's health. How's your health? Have you been to the doctor lately? How often have you seen? What have you seen about? Oh, that's terrible. How many repeats of antibiotics did you get? Blah, 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 and so on. And then questions about, anyone in the family had this, that, or the other. Have you ever been treated for this, that, or the other? And you ask some general questions about that, and you have a conversation. And then there's the K10. If you've already done it, then, you just want to make sure that it's still relevant. And it's really not to be scored. It's just trying to identify and highlight perhaps, feeling a bit down, feeling a bit nervous, feeling a bit depressed, feeling a bit worthless, and perhaps planting a seed that may have something to do with their use of cannabis is really, the reason that you would ask that question. And then you ask about, how satisfied they are with where they're living, with their relationships, their sexual ability, and you expand on that. Oh, can you tell me more about that? Why aren't you happy with that? Again, trying to make those connections, either subtly or not so subtly, between cannabis use and other issues that are happening in their life. And so then we get to legal. You need to find out whether or not, there's been any other issues related, legally picked up or dealing or whatever. And so you ask the legal question and have a conversation around that if there has been, and try to unpack that a bit more. And then we get to the all-important goals, life goals. And you'll see a clip very soon. We're only demonstrating one goal. Now, it's very important that you kind of go through the goals, get them to jot down 5 goals. And then you ask about how confident they are. Now, there's an order in which those questions are asked. So once you've got the 5 goals down, you will say, okay, so tell me, on a scale of 0 to 10, how confident are you? Blah, blah. Well, how involved are you in getting that car? And then the next one, relationships. So tell me, how confident are you? And then you ask, so what are you doing about that? How involved are you in that activity? So you do confidence and involvement. You go down the list of confidence and involvement, and then you leave that there. And then you go back to, what's the likelihood of you achieving this goal? If you were to increase your use and you run down the list, one after the other, what's the likelihood of you to achieve or get a car? If you were to increase, what's the likelihood of you maintaining the relationship with your girlfriend? If you were to increase, getting your own apartment, getting, having money, going on holiday. Now let's look at the flip side, Eric. What's the likelihood of you getting that car if you were to reduce or even stop your cannabis use? And then the next one and the next one. So that's really, it has more impact when you do it that way. So you go down the list with confidence and involvement, then you go back to likelihood if you were to increase, and then likelihood if you were to reduce. So let's have a listen at one. We've only used one example, I think, and that's the car, okay? But I've just explained how you do the others.
Okay, so now I'm going to ask you about what plans or goals you might have over the next 3 years. and I want you to imagine that you're 26. I want you to think about what you might be doing or what you might have at that age. Can you list 5 goals or desires?
I've always wanted to buy a car, I
Yep.
suppose. I've never been overseas.
Okay.
I like to move out of home. And stop fighting with my girlfriend as much and actually save some money.
Okay. All right. Well, let's start looking at your goal of buying a car. So what kind of car is it? I mean, is it what make, what model, colour, price? Can you describe that for me?
Yeah, silver Nissan Pulsar. I'm not sure what model exactly, but I know they go for about 7K.
Okay. Can you tell me how confident you are that you could purchase a silver Nissan Pulsar and that you'd know what you're doing and you'd get the right price and you wouldn't be ripped off? I mean, could you give yourself a score between 0 and 10 as to how confident you'd be about that?
Yeah, I'd say about 5, because I reckon I know what I'm doing.
Okay. What about what you're actually doing right now in terms of getting a car? So 0 is you just talking to me and you haven't really done anything about it. And 10 is that you were out there yesterday and you were kicking some tyres around. I guess what I'm asking you is how actively involved are you in working towards your goal of attaining a silver Nissan Pulsar?
Well, I've done nothing, so I suppose it's a 0.
Okay. Again, I'd like you to rate yourself on a scale of 0 to 10 on the next question. So what is the likelihood that you will achieve your goal of attaining that silver Nissan Pulsar if you increase your cannabis use?
That would be no chance at all. So 0, maybe even a -10.
Okay. So how about if you were to decrease your cannabis use or even stop using cannabis over the next 3 years? What score would you give yourself then on a scale of 0 to 10?
Well, I mean, if I stopped and I could save the money that I spend in on weed, then maybe like an 8 would be pretty easy, I suppose.
So you feel that when or if you decide to change your cannabis use, that attaining your goal would really be within your reach?
Yeah.
Okay, great. Well, let's look at your next goal.
Okay, everybody. All we have now left is relationships, and it's self-explanatory there in terms of the relationships that Eric has with people. Who are they? And as you can see, you can just read what that means. It's important people who they respect and whose respect is important to them, and whether or not they know. And then, of course, the last question is, where do we go from here? That is the immediate goals questionnaire, and all they have to do is circle how they feel, how important it is, how interested they are in reducing right now, in general, in the future, how important is it for them to reduce or use, and how confident they would be in doing that. And Eric, wonderful. Thank you so much for doing that. I really appreciate it. Look, I'm not sure whether or not it's an issue for you. I'm really not sure whether it has anything to do with blah, blah. But, yes, Eric, it has a great deal to do with your DUI and getting picked up. But let me look at all of this information. Can you please come back next week and I'll give you the feedback and we can decide where to go from there, if anywhere. Thank you so much for your time. I hope this discussion has been valuable. And so I just need to put it together and come back. Now, in the event that no one comes back for the feedback, which is very unlikely, what you have to ask yourself, has this been a waste of time? And I suspect that the answer would be no. You are planting a seed or many seeds, hoping they will take root and increasing awareness.